In today's Innovation in Medicine, we're talking about a new procedure that's changing the lives of people dealing with esophageal achalasia. And I am with Dr. Eric Hungness. Now, Dr. Hungness, I feel like we should first explain what achalasia is.
Sure. Achalasia is a rare swallowing disorder that affects the esophagus, where the muscles of the esophagus aren't working correctly. It causes people to feel like stuff's getting stuck. They regurgitate the food that they've eaten, and they can get chest pain. We think that it's related to a viral infection that the patient has had at some point in their lives, and for some reason it attacks the nerves of the esophagus. It only happens in a couple out of 100,000 people.
So historically, the procedure you used to help patients was pretty complex, but today we're talking about something completely different, and that is the POEM procedure.
The traditional surgery has been what's called laparoscopic hilar myotomy. It does involve skin incisions. With the POEM operation, we could go down the mouth and do all the work down there. We can tunnel within the esophagus, locate the muscle that's too tight, and cut it.
And POEM sounds like a cute name, but POEM actually stands for something.
Yeah, it stands for per-oral endoscopic myotomy.
So the POEM procedure then I guess would have a lot of benefits, including a faster healing time.
Clearly without the incisions on the outside, there's less pain. It's very typical that people will at the most stay in one night in the hospital, quicker recovery time. Patients are able to leave the hospital faster than they would otherwise and can return to their lives.
And that's something that sold Deb Coughlin on the procedure.
Anytime you can do less invasive is great.
Deb first started dealing with achalasia several years ago.
And it was with water initially, not going down quickly or all the way. Feels like it's lodged. As it progressed, I would feel spasms, which is just like contractions. It's just so emotional to be in the middle of dinner and then all of a sudden feel that it was not gonna just go.
Her struggle with swallowing also impacted her favorite relaxation activity, running.
I probably was not hydrating correctly. You just kind of take little sips and sometimes you just have to stop and let it go down. You're not really running as fast. Don't have the energy, can't do the distance as much. Because you don't want to eat before.
Hi, how are you?
Good.
Good to see you.
Good seeing you.
Deb teamed up with Dr. Hungness, eager to find relief and get back to pushing herself during her runs.
I had vowed after him describing it, it made sense. The biggest benefit with the POEM versus another treatment was non-invasive, was a big selling point for me.
Deb had the procedure and immediately noticed a change.
The next morning, I noticed right away, my first sip of tea, I just knew that it was going down great. And then I was really back to running by probably day 7. It's so much more enjoyable. I can talk a little bit more during a run. I can hydrate much better. It's life-changing because you can just enjoy the normal things and not be afraid of what might happen next.
To learn more about innovations in medicine, just head to our website, livinghealthytv.com.